Hi, I am Dr. Raghavendra Babu. I am a senior consultant and director for gastrointestinal and hepatobiliary surgery at Cytecare Cancer Hospitals in Bangalore. The term gastrointestinal cancer encompasses a lot of cancers. Gastrointestinal system has the entire digestive system starting from the esophagus, which is the food pipe, the stomach, the intestines, your small intestine, your large intestine, and also the supporting structures for digestion like liver and pancreas. So, when talking about the incidence of cancers in this, if you say the worldwide incidence, it's about 26% of all the cancers in your body. It comprises of GI cancer comprises of 26% of all the cancers in your body. Whereas if you talk about the death rates due to cancers, with gastrointestinal cancers, it's about 35% of death related to cancer happen with gastrointestinal cancers. If you say the same thing in India, this is it's very much correlated. The same statistics is almost equivalent in India. If you talk about the total number of cases, you see about 2 to 2.5 lakh gastrointestinal cancer cases in India per year. So it's a significant chunk of cancer in India. When we are talking about detection of GI cancers, there are so many advances nowadays. When we talk about detection of a GI cancer, endoscopies have improved quite a lot. The upper GI endoscopy and colonoscopy have improved with their resolution, and also with a new technology called as a narrowband imaging, where even very minute defects and very minute ulcers or cancers can be picked up at a very early stage. So, and also when we go further, these endoscopies have further enhanced into something called as a spyglass endoscopy, which is a very new technology, where we can even enter those small bile ducts through those endoscopes and see if there is any cancers inside the biliary system or pancreas or inside the liver. So, these things can be very easily identified. And then next, coming on to the recent genomics and the testing that can be done with that. Now there are further enhancements happening with genomics, where with a single blood test they can analyze the cancer cells in that or genomic mutations in that, and say this cancer may have been there in your body. That is still not completely commercially available, but I think in the future that is going to be there. With a single blood test they can tell you about which cancer is there in your body, with lot of advancement in genomics. So there is so much of advancement happening in detection of cancers with this. So when we talk about newer advances in treatment of gastrointestinal cancers, there is now the concept of neoadjuvant therapy. Neoadjuvant therapy is sandwiching your regional therapy, which is a surgery, between either chemotherapy or radiation, so that you will get a much more complete treatment and better outcomes. We do that in esophageal cancers, we do that in rectal cancers, and also nowadays we are doing it in pancreatic cancers. Pancreatic cancers initially were thought to be completely non-treatable, and most of them were a death sentence. But now with the adjuvant of neoadjuvant therapy, we can even convert some of those advanced cancers into curable cancers using advanced drugs. We have a lot of new drugs coming up to treat these cancers, gastrointestinal cancers. So neoadjuvant therapy is number one. Second thing I'll talk about is once again genomics and targeted therapy. There are so many monoclonal antibodies that are coming up. Cancer is a thing that develops from mutation in our cells. So if we can identify the causative mutation, we can actually target that and treat that. So those things are very easily found out now with genomics. Nowadays we can analyze more than 500 genetic mutation with one single test. More than 500 mutations with one single test. So there we can easily map out what is wrong, which is the mutation, and actually target that. That is already available right now, even though the results are still not up to the mark, but I am sure we will get there. So genomics and targeted therapy is going to come in a big way. Coming to surgical advancements, now we are able to operate on really advanced tumors with blood vessel invasions and other things in a very minimally invasive way with laparoscopy and also robotic technology that we have nowadays. Robotic technology has come leaps and bounds, and it can enable bigger surgery in a very small incision, small cuts. So that is one great advancement that has come in surgical treatment. Cytecare Hospitals is a dedicated cancer care center. The main advantage here is every person, every individual patient who comes across will go through something called as a tumor board, where a set of doctors, a surgeon, radiation oncologist, a medical oncologist, radiologist, pathologist, psycho-oncologist. So, there is a set of doctors who will sit together and discuss and come to the best possible protocol treatment for that patient will be discussed, and that will be advised for that patient. So, every patient will go through this tumor board, and a best possible treatment will be given, and it is not one doctor telling his treatment. So, that is one thing. Second thing, I think the technological advancement, whatever we are talking about, lot of it is already implemented in Cytecare Hospital. The operation theatre is state of the art with minimally invasive surgery. Medical oncology along with the targeted therapy drugs, all the targeted therapy drugs are all available. The laboratory can do all the genomic testings that we talked about, and we can individualize the treatment for the patient. Third thing, coming on to the ambience of it, the service of it is fantastic. It's in a fantastic location with good greenery all around, which gives a fantastic experience for the patient.